afternoon, everyone, and welcome to our, I almost said monthly, I guess it's quarterly now, DHHS contracted provider call. For those of you that are new to this meeting, we will have division representatives throughout the organization give some key updates. As I will turn it over to them, we will also allow you to post your questions in the chat box at the bottom, and we will answer those as time allows. If you need live transcripts, there is a CC at the bottom of your Zoom screen you can turn on as well. All right. If any time during the meeting, enter them in, or you have questions, enter them in the Zoom chat. We'll allow some updates from each division, and then we will move to a question and answer section. Additionally, if you have questions outside of this meeting, you can email them to our CQI group, and we'll drop that email in the chat. All right, just one more quick update. I know we've had this call has transitioned over time, and it seems like previously the majority of the time was spent on COVID updates. As most of you are aware, we have transitioned to the COVID steady state for Utah. And so our COVID guidance for DHHS has been updated to reflect that on our website. So please make sure that you're referencing that. Again, if you have any questions, feel free to drop them in the chat. So now I will go ahead and start turning it over to our operational units, and we will turn it over to Shannon first.
Thanks, Amanda. And hello, everyone. Glad to be here with you today. So our first is just a little, my first announcement is just a little bit of some organizational changes. As you know, as we have merged and we are now DHHS, and we are still, however, in the process of figuring out how best within our OUs the organization will work to ensure that we're giving clear and consistent guidance to our providers. Our Office of Service Review has had a little bit of an organizational change. Nothing huge. Nobody in the office has changed. So Carrie Bamber is still the office director. However, our related parties investigation and fatality review teams will now be reporting to Chandler Mentier. Our quality management team will be reporting to Jessica Hooper. Our internal service review team reports to Jeff Harrop. Then Chandler, Jessica, and Jeff will report to Carrie, and Carrie reports to me. We will drop a chat to our new or drop a link to our new org chart in the chat. So please feel free to print that out, use that, bookmark it, and go back to it. It is actually a live update. So anytime we have changes, those will be updated on that org chart. You can always see that. Another thing I want you guys to be aware of is that you will be seeing some changes in our provider letters, particularly around recoupment, which you've previously heard referred to as paybacks. So with the consolidation of DHS and DOH, integrated health is now, of course, in the same department as Juvenile Justice and Youth Services, Division of Children and Family Services, Aging and Adult Services, and Continuous Quality Improvement. So our letters are now going to reflect that, with information on how to request review of any recruitment decision, as well as how to request a formal appeal from Medicaid if it applies to your situation. Additionally, all of our letters in the Continuous Quality and Improvement letter division are undergoing review, just as part of our standard quality improvement process. So you may see slight alterations to other letters in the future. Just want you to be aware of that. And then finally, just want to let you know that the quality management team has started unannounced site visits for the home and community-based service providers. Overall, we have been seeing some really positive implementation of services and supports. But one area we are providing a lot of TA in is in regards to the human rights restrictions. There are several resources that are available that we do encourage all of you to review in regards to these restrictions, just to ensure that you're implementing human rights restrictions appropriately. And we should have a few links for that for you guys as well. And that is the end of our updates for Continuous Quality and Improvement Division. And I think we are moving to Leslie with Division of Child and Family Services.
Hey, everybody. I'm Leslie Lunderberg. I'm our Service Continuum Administrator with Child and Family Services. I have a very short agenda item. Some of you may already know this, but our previous director, Diane Moore, has retired as a few weeks ago. And our interim director right now is Tanya Myrup. She's our assistant director. Just tuck that away in case you need that, but that's all DCFS has today.
Thank you, Leslie. And it looks like I'm not seeing Rachel or April from JJS on here. If you all are on here, interrupt me. So I'm gonna go ahead and kick it over to Chanel.
Thanks, everyone. I'm Chanel Long with the Office of Substance Use and Mental Health. So I have a couple of updates. One is we have not held our Utah Fall Conference for the last couple of years because of COVID. So I do want to announce that we're going to have the Fall Conference returning next September. So it'll be September of 2023. It's typically held at the Dixie Center in St. George, and we will continue to do that. We don't have a more specific date in September to be held. I think we're still working with the venue to see exactly what dates are available, but I'll keep you posted next time we meet to see if we've got a date specifically planned for that. But that's usually our substance use fall conference that we haven't held for a couple of years. The next one I have is that one of the goals of our state plan to prevent suicide in Utah was to provide training and education to individuals across the state and to recognize the warning signs of suicide and educate the public on the important topics such as safe messaging. To help us meet this goal, our suicide prevention team has been working around the clock to put together the first ever suicide prevention training taught entirely through Instagram. Some of you may have been receiving some of those updates through your children's school or through emails. We believe this will increase the accessibility of the important information and ultimately reduce suicide in Utah. So part of the Live On playbook is posted on Instagram, which is at Live On Utah. It's a very exciting educational tool, and we're so excited to have it out there. If some of you haven't seen it, please check it out. Please share with others. We believe this will have a big impact on our community and really are excited about the kickoff for this program. Thank you. That's all that I have for today.
Thank you, Chanel. And yeah, I will just second, if you haven't seen the Live On playbook on Instagram, it's really great and it's short and digestible. So definitely check it out. So I will go ahead and kick it over to Jamie with DSPD.
Okay, thank you. Just a couple of things actually this time. So we have set up another email that you can reach out to for access to USDC. We continue to receive requests to access USDC. We're trying to streamline the process and allow everyone an opportunity to request support. So we've set up an email, which hopefully can be added to the chat. It's usdcadmits@utah.gov. So we're going to be checking this email every day and connecting you. There's the opportunity to connect with staff if you need it right away. The admission and discharge process to the USDC has changed, and that's tied to past audit. So I really encourage you to take a look at what that looks like now. It's on our DSPD website under our internal directives. It's Directive 1.50, and it's called Transitions Between HCBS and USDC. And I'm hoping we can get a link to that in the chat. If you have any trouble accessing the directive, then you can email me directly and I'll make sure you get a copy of that. USCC wants to be available to help everybody, obviously, but they have the same kind of staffing crisis. They have the same kind of needs to serve the right people for the right fit. And so they have to make sure that they are bringing people in that they can properly serve and that they're not affecting the environment of the people who are already residing there. So just keep that in mind when you're asking for an admit. The other thing I wanted to talk about is ICF admissions. DSPD provides home and community-based services, and DSPD staff encourage the use of home and community-based settings. We continue to hear from support coordinators requesting access to ICFs. While this is an option for the individual, it is not a decision to be made on behalf of the individual, and pursuit of an ICF should not be in response to provider capacity issues, and it should not occur without outreach and education involvement. As a reminder, we've set up an email to assist support coordinators in finding home and community-based options if provider capacity issues exist. It is the residential supports email we've talked about earlier. Hopefully we got that in the chat. And if there's anything else that DSPD can do to support you as far as finding appropriate home and community-based settings, please don't hesitate to reach out. And that is all I have.
Thanks, Jamie. I appreciate that. Just a quick thing before I move on. Some of you have probably noticed our chat feature is not working. So we will send a follow-up email with the links we've referenced today after this meeting. However, when we get to the question and answer section, we'll just have you raise your hand and call on you live. But just wanted to let you all know if you're looking for the chat feature and not finding it. It looks like it's not working. So if we get that working, we will. Now I'm going to turn it over to the Division of Licensing and Background Checks to you, Carmen, first.
Yeah, thanks, Amanda. I'm kind of excited because I'm starting to recognize names and processes and things we do in this interim position. So yeah, I'm Carmen. I am the interim director of the Division of Licensing and Background Checks. Wanted to give you guys an overview of our structure again. It's a little bit confusing for providers, as it has been for us as well. In the past, for Human Services, Amanda Slater was the director over the Office of Licensing and Background Checks. As we merged with health, we brought on licensing for health facilities and childcare. And now we have a office director, Simone Bolivar, who is here as well. He is the director over the Office of Licensing. So he is over Human Services licensing, health facility licensing, and childcare licensing. Within that process, Amanda also used to be over the Human Services background screening component. We separated that out, and within that office is now the interim director is Daphne Lynch. She is here as well. And Daphne is now over Human Services background screening, health facility background screening, childcare background screening, along with a bunch of other components that are just odds and ends. And most importantly, the employees of the Department of Health and Human Services. So just kind of a little bit of structure change. I will say though, all three of us are welcome to take questions if you need something. If it goes to the wrong person, it's not a problem. The three of us work together well, and we will send it wherever it needs to be or help answer questions for each other. So, all right, thanks. And again, I'm kind of excited to start recognizing people and that I've been working with. So kind of fun for me. I'm going to turn some time over to Daphne. She's going to update us a little bit on some training materials that they're doing for background screening for Human Services.
Thank you, Carmen. Hello, everyone. I am excited to announce some training materials that particularly are relating to DAC. So we have, because of the merger, we have combined our website. And so even if you are still using the old website, that's still going to be able to take you there. But and as Carmen stated, we are over, our office has grown with what we cover. And so we're changing our website, changing places that we have access to things. So we have a new website that will get you all the link to. Essentially, it's just dlbc.utah.gov. And so there you're going to be able to find everything regarding all of these programs. Under specifically background screenings, we are going to be removing all the DACS training materials and revamping those and posting those as we get them. So if you do need to refer to any of the DACS training materials, I would download those by the end of this week so that you can refer to them, because we are going to be removing all of those and then revamping that, placing them in giving you shorter snippets, organizing them so that you can find what you need faster, and you don't have to look through a whole entire document. We're going to be splitting everything out that way. And so to help you in as you are training new people, or if you have questions regarding that, and just making sure we're getting everything up to date, especially because of the merger. Okay, and then I'm going to turn it over to Simone, so you get to hear from him and his processes with Office of Licensing specifically.
Good afternoon, Simon Bolivar, Office of Licensing Director. We're working on different processes now that we brought the three programs together: health facilities, human services, and childcare licensing. We're working on the different areas to make sure that the processes are as simplified as possible. Something that all providers are going to get to know, because we're just in the process of meeting with the different groups, explaining the process to each one of them, is a program that we are putting together to simplify processes again. And it is called the Prevention, Correction, and Revision of Non-Compliance. This is so we can be a little more transparent and can explain the situations to provider in an easy way, so we don't go from 0 miles to 100 miles at once. We give providers the opportunity to see, prevent, correct, and review the process. You're going to see new language, simplified language. For example, we're going to call situations warnings or citations, and it all depends on the level of risk of the rule or the requirement that the Office of Licensing is checking on. You're going to see an inspection report, for example, in which we will detail the information a little bit more clear than before, where at the end of every inspection, we will give the provider an inspection report detailing what the information that we have found is. We're improving also our systems. We're in the process of updating into a system that is going to give us the opportunity to have access and print reports and write facility compliance histories. And as Daphne said, we're also improving our websites to make sure that the communication is more comprehensive, easy to access. So all those things are being worked on, and every group of providers are being told of the adjustments. We don't call them changes, we call them improvements, because we're building on what has been built in the past to make sure that we provide a better and more transparent service to you. That's all I have as well.
Thank you, Simone. So we do have Nathan Cruz here with the Office of Coordinated Care and Regional Supports. He had one thing that he can probably give a quick update on. Nathan, I'll turn it over to you.
So we've been able to streamline the contact information we have available for the nursing contract for our residential agencies in order to meet the QRTP standards, Qualified Residential Treatment Program standards. So there's one phone number available for all calls that will be triaged, and that number is 352-504-3126. So that should get you directly to be able to contact a nurse should a situation arise where you need to staff or triage some medical concern or emergency. Again, this does not take the place of any immediate service that needs to be taken care of. If a child needs to be taken to the emergency department room, please use your judgment in that regard and do what is most appropriate in that setting. This is, again, to meet the QRTP standards.
Perfect.
And that's everything I have.
Thank you, Nathan. All right, I will go ahead and turn it over to Joe.
Hey guys, I am the one that you get to blame for not having the chat in the meeting today. So apologize for that, and we will we'll get it fixed for next time we all get together. I have the fortune of getting to share with you the next stage of our kind of healthy living, healthy Utah campaign. So I'm going to share my screen here. And I wanted to introduce you to what we are calling the up-to-date program or up-to-date campaign. As we transition away from, and as COVID has less of an effect in our lives, we still need people to make really healthy decisions. And some of those healthy decisions are related to the immunizations we get, and really just regular time with our medical providers, doctors, or whoever it is that you visit. So we launched this campaign, and you will see it's right here on the front page of our website. You can see the Stay Up to Date logo, but you'll see this, and hopefully have been seeing it across the state, as we have the information on billboards, radio, TV, internet, display ads, just everywhere that we can stick this message. We've tried to put it in all of those locations. And I wanted to show you really what the point of all of this is. So if we can get people to go to uptodate.utah.gov, or if you come to dhhs.utah.gov and you click the link right there, it takes you to our specific set of pages about how to stay up to date. And we have all this information in English and in Spanish. And actually, this is really two campaigns in one. The first campaign is geared toward parents of children to help them get their well child checks, get their childhood immunizations up to date, and have those visits with their providers. And then the second part of the campaign is really that notice to adults, to remind them that, you know, your body's functioning, but it doesn't always give you warning signs. And that's why you need to go and have some time with a doctor. And so these two campaigns are running side by side all the time, one to help the parents and one to help adults. And the really cool tool that we built into this is something where you can go here and click one of these drop downs and pick the age of a person. If you're a parent and you want to look for what is it that my child should be doing right now, what are those checks they can have, you can pick their age and it will give you an example. So let's say we'll have someone who's age 3 to 6. We go right to that website and it says, okay, well, here's the immunizations that a 3-year-old could have. They could have COVID, they could have their influenza vaccine, and then you should ask your provider to make sure your child is caught up on all of them. And then here's some things that you might talk to a provider about: developmental milestones, brushing their teeth, healthy snacks, nutrition, playing with other kids, potty training. That's like for a 3-year-old. Maybe for a 4-year-old, you might talk about rules and discipline, screen time, sleep habits, routines. And of course, some of those are going to be similar across many age groups. The one that really applies to me, even though I am a parent, is what we're calling the alert campaign, where hey, what are the things that Joe needs to look at? So let's just pretend that I'm between ages 40 and 64, and I want to see, what is it that I should be thinking about? What are those checkups I should have? Make sure I'm caught up on these various vaccines: COVID, hepatitis A, B, influenza, measles, mumps, rubella, possibly, and then reminding me that around the time I'm age 50, I should be considering the shingles vaccine. Some other things that I may need: HPV, meningococcal, and other ones as well. And then the wellness checkups. I should probably be having a checkup with a doctor every year. I am probably the person this campaign is most geared for, because I am someone who kind of resists going to a doctor. It seems like every time you go to the doctor, they want to cut something out of you. So, but I should be doing these things. I should be having checkups for testicular cancer, having a hearing test, having my heart checked, those things to make sure that I'm catching anything that I need to catch before it becomes an actual problem. So that's the whole point of this campaign. Kind of like your maintenance calendar, maintenance schedule for your vehicle, we need to have the maintenance schedule for our bodies as well. And that's what uptodate.utah.gov is all about. And so we will be sharing the link to you in the email that we sent up as a follow-up. After this, of course, we're available if there are any questions as well on this campaign, but we look forward to it. Please share it with those who are around you and help them know what they should be doing to stay safe and healthy as well. Thanks.
Thank you, Joe. Yeah, this is a great campaign. I was feeling pretty good about myself. I got my flu vaccine and my COVID booster. And then as Joe just showed that, I'm realizing maybe I should do a little bit more checkups. So please definitely read that out there. But thank you for everyone presenting today. As we mentioned, unfortunately, our chat feature is not working. So what you can do is in the bottom of your screen, there's a little smiley face with reactions where you can raise your hand. So if you have any questions, you can raise your hand and I will go ahead and call on you. And while we're give it just a few more minutes if there's any other questions. I did get one via email, Shannon. I'm going to throw you on the spot. There was somebody asking if you could mention more on the human rights piece. They just kind of caught the back end of it, but maybe didn't catch the whole thing. So if you could just give that quick update.
Yes, I will speak briefly to it, but then I think I might put Jamie on the spot to speak a little bit more on it as the subject matter expert. So just for the human rights issues, as you know, very much with DSPD, with the people that DSPD serves, we want to ensure that their human rights are respected, and if they have to have one of those human rights perhaps restricted, that there is a real reason behind it that fits in with up-to-date recommendations, and it's not just perhaps to make for convenience sake or anything like that. We just want to, and so there is, we have a national standard for that is evidence-based, and you will get links we send out from this that actually goes further into that. But with that, Jamie, do you have some additional detail and context to add on that? Are you still here, Jamie?
I think we may have lost Jamie.
All right. Well, we will get some additional information, and definitely we will send out those links that provide some tools for you to utilize for the services you're providing and to guide some more direction there.
Thank you, Shannon.
I can pop in a little bit on that because I was just with DSPD. This is Jason Lyons. So yeah, DSPD is working on doing quite a bit of training with human rights restrictions / modifications. So I would just keep an eye out. Some of those trainings and documents should be coming out in the next few months.
Thank you, Jason.
Mm-hmm.
Perfect. Do we have any other questions? Maybe making everybody raise their hand made them shy today. Go ahead, Erin.
Hi there. I think this is a question for Daphne. Daphne, you mentioned having 2 different background check sites, the old DAX and sounds like the new one. For the time being, can we still use DAX for any background check applications? Or I guess I'm curious about that.
Yes, hi, Erin. So we're not changing DAX, we're just changing the training materials on our website. So DAX and the way you access DAX will all stay the same, but it's just going to be the training materials that we are going to be taking down and revamping and organizing better for you to have access. So that's not going to, DAX itself isn't going to change. It's just the training materials, and it's just our division website that has been changed.
Perfect. Thank you so much for clarifying.
You bet.
Thank you, Erin. It looks like next up we have Emily.
Who would the point of contact be for the Office of Continuous CQI? I believe that's what it is.
Are you okay if I just jump in, Amanda? Hey, Emily. So I am the division director for the Division of Continuous Quality and Improvement. And then within the Division of Continuous Quality Improvement, we have the Office of Service Review, which often is the office that providers have a lot of contact with, and that you can start with Carrie Bambro on that.
Perfect. Thank you so much.
You're welcome.
All right. Do we have any other questions? Okay. Well,
It looks like, oh, was that was Emily who, okay, good,
Yep.
sorry.
you're good. Thank you for catching that, Joe.
Yep.
Sometimes I
Yep.
don't always see them, so. Let me do one more look that I'm not cutting somebody off here. Well, thank you all for being on today. Again, we apologize that the chat feature was not working. I know we gave a lot of links and email addresses today, so we will make sure that when we send this recording out, we include all of those links in there so that you have them. In addition to that, I just wanted to remind you that anytime, between these meetings that are quarterly, if you have any questions, you can email them to DHHS_CQI@utah.gov. Sorry, we don't have the chat, so I'm saying it out loud, but we'll include it in the email. Either prior to this meeting or in between, please feel free to reach out and send those emails as you have questions. Thank you all for joining us today. I appreciate all the work that you all do to help us meet our vision to ensure that all Utahns have safe and I just messed it up. I'm so sorry that all Utahns have fair and equitable access to be healthy and safe. Thank you for all you do. We appreciate you and have a wonderful rest of your day.